Welcome. We are here to talk about creating resilience across the continuum of care. I have a few folks with me today. Do you want to do some introductions?
John Frownfelter here. I'm a physician. I've been in health, IT, physician executive roles since 2006 in various organizations. I'm passionate about both clinicians and about patients and patient care, and I love taking on the challenges that never seem to get solved. And the, what we have the opportunity in front of us is to take the disruptions of technology that are impacting healthcare and do something novel, do something that's never been done before, unprecedented, and help our clinicians and in patient care delivery processes, and most of all, our patients.
Yeah, perfect. Will Conaway.
Thank you, Heather. Appreciate being here today with everybody. Will Conaway, Vice President Consulting and Provider Leader at NTT. I've been with NTT Data since April of 2023. Over my career, I've served as a large organization Chief Information Officer, Chief of Staff, Chief Operating Officer, and Chief Growth Officer. I have a long history of teaching at Cornell University. I've published numerous articles and contributed to a 2023 best-selling healthcare book. I was the recipient of the Business Constellation Transformation Award in 2020 and 2022, and I was the recipient of the 2023 ICON Award for Global Impact in Healthcare Technology. Additionally, I've served on many boards and looking forward to bringing some of my background, hopefully bringing a few words of wisdom today, how we can improve some of the items that we see going on in healthcare daily.
Yeah, I love it. I am in good company today. So, some smart folks with us. I'm Heather Haugen. I lead our healthcare consulting division within NTT Data. Have spent my career on the informatics side and also am faculty at the University of Colorado. Really passionate about how hard it's become to both work in healthcare and be a patient in healthcare. And so anything we can do to give time back for patient care and improve that process for everyone that serves in healthcare and for the patient and their family is something that's really important to me. And we're going to spend some time on those topics today. Let's start by talking about the transformation we've seen to digital records. So EHRs gave us troves of data, but they also created a burden on clinicians around documentation, around nurses in some of the processes that we implemented. It gave us access to allergies and medical history for emergency medicine, which has made a dramatic difference for patients, but we still are challenged by sharing data. So we've made these huge leaps in quality, access, and safety, but there have definitely been some unintended consequences and challenges of that. Will, you want to talk a little bit about what you've seen around quality of care and how this is working?
Oh, absolutely. This is a great topic. We have seen in digitization over the past few years, it's really helping healthcare out. For example, we're seeing great progress with digital tools, permitting healthcare providers the ability to create personalized treatment plans, predict health risk, and even design interventions for the individual patient. Another item that we continue to see it's really in growing importance is access, and that is digital technologies can improve access to healthcare for the underserved population, something that we all value. An example would be telemedicine, where remote monitoring makes it possible for chronic disease and growing issues pertaining to behavioral health to be addressed. Something all healthcare systems want to see more is the enhanced data management, and we're seeing that right now. Digital tools are allowing the ability to improve data management, leading to better decision making with our people on the front line, our clinicians. And also another item, I think, just around improved efficiency. Digital tools can improve healthcare providers' efficiency by automating and accelerating labor-intensive tasks that we do day to day. And see, this is vital considering the provider shortages, which are getting worse. I would also like to add on to that, this can really lead to reduced cost. When you're considering that the average hospital is running at about 2.3% margin and about 30% of all healthcare costs can be attributed to administration, digital tools have been shown to be able to save somewhere between 15% and 30%, even higher in some situation. So I would say that, and maybe the most important thing that we all like to talk about is improve patient engagement of late. Digital tools can improve patient engagement and satisfaction. These tools have really become a larger part of the episode of care, and the patients are better informed about their own treatments.
I'd like to tag on to that, Will. You mentioned data management. This is what I've seen over the last 15 years is data obviously is king. We all aspire to have as much data as possible, but that's both the goal and also the problem that we face today. Is more data is more information, but it doesn't equal more intelligence, and it equals more noise sometimes. And getting the signal to noise ratio correct is a real problem as we have increasing amounts of data available and at our fingertips. So you mentioned data management, and again, I think that this is still a foundational flaw in many health systems today is a robust and mature data management approach. And I would summarize it like this: being able to get complete amount of data, especially on every single patient, that leads to perhaps a 360-degree view of the patient. But completeness of the data is important, but it also has to be correct. There are discrepancies, there are conflicts in data when we get them from multiple sources that that just create confusion, and sometimes errors are propagated throughout the records, just as they were in the paper world. And I think we can do better. And then harmonizing that data so that you've got not just one source of truth, but a reliable source of truth. It allows us then to do whatever else that we want to do on top of it. What would we want to do on top of it? And you mentioned decision support. There are opportunities for artificial intelligence to come in and leverage the truth to do work, automate things that are administrative, non-value added workflows for nurses and physicians, the ability to do everything from digital scribing for physicians to creating handoff summaries for a hospitalist or for nurses from one shift change to the next. All of this requires that we have accurate data and that we're using it well. And there's a foundation of I would say data maturity or data management that's got to be laid in many health systems today. There are cracks in that foundation.
Absolutely, John. And I think the other thing that we're seeing is data governance is becoming such a critical piece. It was always important. We have more and more data. We need to gain insights from it, be able to make decisions. But even that decision making and policy making in organizations, I think that data governance is becoming more and more important. And we'll be talking about this throughout our conversation and thinking about AI. All of a sudden you go, we're going to have some really strong data governance and understand what kinds of data sources we're using and how we're bringing data in. You also talked a little bit about the concept of automation, and I think it leads us to think about clinician burnout. So as we start to talk about the impact of digitizing healthcare, you just can't avoid the conversation of not just physicians, but across the board, from specialists, nurses, techs, to the amount of cognitive load that we have placed on our healthcare teams. And when we do that, we're starting to see the impact on patient care, families, quality of care, and even sometimes access to care. So, as we're thinking about clinician burnout, what are the kinds of things that the two of you are seeing that really assist with decreasing that cognitive load?
Oh boy. Let me start and again put an exclamation point on the context and the history. Our legacy, and I say this as a clinical informaticist that has been involved with deploying electronic health records since 2006, and seeing the effects of what we intended to do in the very best possible way. But we've layered technology on top of technology, and complexity on top of complexity, which has created cognitive work burden for clinicians to the point of to the extreme. That is a cause of clinician burnout, is the layers of technology creating increasing complexity that exceeds the value that it's bringing to the clinicians in terms of their workflows, in terms of efficiency, so that a number one priority for physicians and nurses around the country is improved efficiency and improved effectiveness in their day-to-day work. So that's the context. Is we've created, with the very best of intentions, a very complex environment in which healthcare is delivered. So now I'm going to take one more step here forward with what's the power of AI and generative AI to help with this, and I'll give you a framework. We're going to start in many of these areas with a concept of assisting clinicians, and assisting meaning informing maybe some action we're going to do better, or doing some very non-value added workflow in an automated fashion in order to tee it up for the clinician. And that could include like pulling summary reports together, et cetera. And those tools are now in many electronic health records. So assist. And then augment takes it a step further, where in real time, I might be able to change the thinking that's going on around the patient, decision support, or prompting with intelligence that's being brought in from multiple sources for the physician decision making, or for nurses in doing their care of the patients. Then ultimately, the highest level of sophistication, which is going to be seen more in the next few years, not so much today, is automation of some aspects of care processes, and that is coming. But assist, augment, and then automate. Now, let's just take, for example, one hot area in generative AI space right now is digital scribe, and let's look at what it is today. Right now, what we do is we say, well, let's take the lowest hanging fruit, create that note for physicians. They still have to review and edit it, and there are just now some data coming out that some of the errors being generated by those absolutely requires a physician, the author, to review and take ownership of that note, just like they did when it was transcribed, by somebody, in another room or overseas. Has to be reviewed before it's signed by the physician. But that creates some efficiency. As we get more mature in that space, we can redesign the entire processes around that. What is the purpose of creating that data in the first place? How am I going to reuse it? And as we look at all of those workflows and those processes, we can create a whole continuum of activities, many of which will be automated. And the physicians are part of that process then, instead of sometimes the owner and sometimes the victim of that process. So that's the future, is the ability to redesign end-to-end what the creation and the use of that data is for, and physicians get to play their part in it in a more comfortable way.
Yeah, and I'm going to ping on to that. I think that was really nice. Both Heather and John, you've mentioned something I think that's important, and it kind of jarred a memory that I had. I was fortunate to work for a healthcare system that was an early adopter of EHR systems. And I think part of the problem is when we talk about the burnout, maybe bad starts on some types of technology, was I don't think it was ever defined how the EHR system was going to work throughout the system. What I'm talking about there is, I remember coming in to work and hearing the major EHR systems talk to us about the benefits. When they sold it to the C-suite, they talked about revenue. It was revenue capture. That excited everybody. Obviously, everybody wants more revenue capture. I think the second thing was when they talked to the people like Dr. Frownfelter, they really sold that as better patient care. So we had two diverse, points of view coming in. Both have ended up to be correct today. I believe that they are getting better, these systems, and they are helping. I mean, still, is it leading to physician burnout? I would still say that the EHR system might be on the top of that list. I mean, there's a lot of physicians going home doing desktop medicine, I like to call it, where they're doing finishing up the day's work at 11 o'clock at night, and we don't want that. The other thing is that a concept that we talk about a lot is, we want people to be able to work at the top of their license. And in simple terms, this occurs when a healthcare professional uses their full range of skills and trained to provide the best care for their patients. A few examples of this, just in very simple terms: a surgeon performing surgery, a nurse practitioner writing a prescription for a patient. Other items that we've seen is that we're still watching reduction of administrative workload, which is important. And to Dr. Frownfelter's point, AI can automate task and data entry, clinical documentation, pre-auth request, and freeing up time for the providers to really spend time with their patients. Other things we're seeing is that AI is allowing us to really analyze large data sets much quicker, obviously much quicker than we did before. And real-time insights and recommendations are really going to support the clinical decisions that we're seeing. So that is a major step up. We're going to see AI streamlining the workflows we've seen, optimizing, resource allocation, which will lead to better efficiency throughout the hospitals. Patient reminders has been a huge deal we've seen. And an item that I know that patients appreciate is that AI can send automated reminders for appointments, medication refills, and even follow-up care. That's also good for the hospitals too, because you want to stop network leakage. This is a way and a tool that can do that, can save hospitals millions of dollars a year. And I would also say one last item here, and I'm going to shamelessly give a nice plug out here for NTT data, but we're watching some great things happening around imaging. And with the analyst tools that we have, AI can assist radiologists by identifying, abnormalities in medical images, improving diagnostic accuracy. This will continue to enhance NT&T's growing PACS service line. I think we're going to see some great advancements over the next years, and I believe we're going to be right on the forefront of that.
It's so interesting to see those trends that you're talking about, Will, around, where our focus is in healthcare, and the systems in imaging have gotten really old and pretty clunky. But I think this concept that you and Dr. Frownfelter are talking about, I just want to really reinforce, which is, despite being this incredible technology company, I think all three of us would say we've worked in enough healthcare organizations to know that technology is far from the solution and fix. We know that process. We know that the governance around how we make these decisions and how we use our data is going to be critical in the go forward path. We were just recently at our client advisory board meeting. And I think it's always interesting to listen to our clients really closely when things like AI and Gen AI are coming up. And right, we have, many of them saying, this train is going very quickly. We're getting a lot of pressure from vendors and others to implement things that, we're having to look very carefully at and being smart and implementing in a thoughtful way. And yet they're seeking solutions that give them this, time back for patient care. And especially on these concepts of, search and summarize records and save me time, help me write a letter, help me improve my daily processes so that I can spend time with patients. And we're seeing that continuum all the way across. And I know, Dr. Frownfelter, you've just done some incredible work here. And some of our clients have given you some feedback about, what's important to them in those areas.
Yeah, we're doing a lot of exciting work in this space in clinical care right now with the power of generative AI. So I'll give a couple of categories that are hot, and not just for NTT, but across the whole industry. Clinical documentation tools, whether it's the classic, now I'll say classic digital scribe with generative AI, classic meaning it's almost 2 years old now, amazing. Also areas of opportunity and revenue cycle. More interesting now on the cutting edge, I would say, is what I would consider is knowledge management, the ability to bring large language model facilitated intelligence into the fingertips of the clinician right as they're thinking about what the challenge is with this particular patient. And then there are patient-facing technologies that are evolving as well. And again, everything is starting in a safer place. So you say, well, I need a virtual agent to interact with the patient to help them get appointments scheduled. Great. But now there's a whole lot of, there's a crop of vendor companies popping up around engaging patients for health coaching, medication adherence, being the best version of their healthy self. This phrase of patient being their own healthcare hero. So you have what's starting to happen is not just democratization of medical knowledge, but now democratization of medical expertise. where patients are going to be able to have really good intelligence and informed insights at their fingertips. This is what's evolving and coming now in the next couple of years, and we're excited to be part of that.
I'm going to add on to that. I think that that's interesting. And Dr. Frownfelter, you noticed fingertips of the users, also expertise, and this also applies to the provider consultant and the groups that we work with each day. When we look at AI, we as an organization are trying to put AI in all of our offerings. More technology, more AI. From our newest employee to our most experienced, we are getting educated. We want AI to advance our ability to provide value to our customers. Additionally, AI is going to give us a different way of thinking about things and how we do our business. I'm very proud to say that all of our provider consultants are level 3 Gen AI certified. That's the highest level we offer here. I also believe that AI is going to really augment the way that we can provide that value to all of our customers. There's 7 things that a great consultant needs to do. AI is going to really integrate into all of these, and that is great consultants need to know their partners better. Great consultants can define, understand, and solve partners' pain points. AI is going to bring additional information for that. Great consultants, they know the industry well and can predict trends. Nothing's better at predicting trends than great data and AI. We're going to see much more the ability to really be, able to help healthcare systems with data that we can look at, compare with other systems to really bring the value to them. Great consultants have an innovative insights that can be implemented. Ultimately, coming up with an idea is not the end solution. It has to be able to be implemented. Great consultants will now have tools on hand to be able to implement these and deliver value to their partners. Great consultants have a strong sense of internal clarity. This is bringing our organization as one organization closer every day. It's allowing the people on the floor to have tools and experience and abilities that typically we'd see at people at much higher levels. So this is wonderful there. Also, great consultants bring well-formed strategies. We're able to run mental models that we've used in the past, but now we can use AI to take those mental models and drive those into what we really believe the end results will be. We're going to be able to really have lessons learned like we've never had before. Great consultants bring capabilities that evolve with time. Once again, AI is allowing our consultants to stay relevant, and they are able to look at your brand, what you need to do, your service lines, how you need to grow, and put those items together for you. And finally, I would say that great consultants know how to serve a greater purpose. AI, once again, is allowing us not just to do things right, it's also allowing us to do the right things. It's helping us provide the direction that we need. It's a very exciting time to be in healthcare. And AI is just going to bring the consultant closer and closer to the healthcare system, to the patient, and to the patient's episode of care.
And just a couple of thoughts as I'm thinking about how we land this plane here, Heather. First of all, it's never never too soon to bring relief to clinicians, but it's just in the nick of time in this case. I do believe AI is going to bring both intelligence and automation, and is already doing so, to the point of care, and it will bring workload relief and allow clinicians to get back to both the cognitive work, which is what we're trained to do, and also more direct face-to-face time with patients, which is the rewarding part of healthcare for many of us. The second thought, though, is this: the ground is moving under our feet faster than ever in terms of evolving technologies, and the pace of knowledge is accelerating in terms of what we need to know in order to deliver care. So care delivery is more complex than it's ever been in the history of medicine. And so artificial intelligence is going to become the new user interface for clinicians to be able to adapt faster to the changes that are going on in healthcare. So I like to say that AI is going to become the new UI, because we're going to depend upon the knowledge management of the AI to filter, to adapt, to surface changes in medical knowledge that we are no longer able to keep up with. And again, it's just in time.
Absolutely. We have covered a lot of ground, from the importance of digitizing care processes and records, and how far that has brought us, and how far we are from the end of this journey. And our resiliency as healthcare leaders is what we've always known about people and process. Those are critical, hard work things that we have to go do. Leveraging technology, being really smart about how we use technology in our organization, um, and automation. And we're really bullish around how AI and Gen AI can give us time back for patient care and ultimately help the way care is delivered. We also want to give just a big thank you to Health Leaders of New York for their partnership in this important work. Thank you.